this way. No towel. Bring this way.
Did you know that before Louis Pasteur laid down the groundwork for germ theory, and well before Dr. Joseph Lister's work on antisepsis in surgery and preventive medicine, there was a Hungarian-born physician by the name of Ignaz Semmelweis who, in Vienna in the 1840s, made some critical observations about the importance of hand washing, and he would later become known as the Saviour of Mothers. At the time at Vienna General Hospital, there were two clinics in which women would commonly give birth, the first obstetrical clinic and the second obstetrical clinic. Well, it was no secret either to healthcare workers or the general population alike that women who gave birth at the first clinic had a 2 times higher risk of puerperal sepsis, also known as childbed fever, which was also associated with the risk for maternal death. Semmelweis apparently was distraught at the increased mortality at the first clinic, and a couple of things would happen that would help him understand and really advocate for the importance of hand washing. In the first place, one of his dear friends who was performing a post-mortem exam was accidentally poked or stabbed by a medical student, and his friend would later go on to die with the autopsy demonstrating pathology very similar to women who contracted puerperal fever. Another important observation was that women who delivered their babies at the first clinic oftentimes had their babies delivered by medical students, whereas women at the second clinic were exclusively treated by midwives. Semmelweis was convinced that medical students must have been carrying some sort of cadaverous material on their hands between the time of their cadaveric dissections at the medical school and then their examinations that they were performing on pregnant women at the first clinic. Therefore, Semmelweis introduced a policy of mandatory hand washing with calcium hypochlorite, which is a form of chlorinated lime, between the time of performing autopsies and evaluation of patients at the first clinic. Shortly after the introduction of this hand washing policy in the spring of 1847, the risk for puerperal sepsis decreased by 90%, and within months, the risk for mortality among mothers was 0%. Unfortunately for Semmelweis, the local medical community was not very receptive to his ideas, and he essentially was laughed at and chased out of Vienna. Many years later, in the 1860s, it was reported that Semmelweis suffered a nervous breakdown, which resulted in him being institutionalized in an asylum. Unfortunately, he would later develop sepsis due to a wound he sustained on his hand after being beaten by guards. And that's a brief tale of the Saviour of Mothers. Be sure to like, follow for more. Happy Mother's Day, everyone.